every Wednesday, 10:30 to 11, when I'll talk to local and regional authors. So please join me Wednesdays here on 90.9 FM KSJE, Farmington.
KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them. Whether it's a stroke, heart attack, illness, or injury, San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Ten minutes past 8 o'clock. It is Wednesday morning, August 5th. Good morning, everybody. I'm Scott Micklin, and thank you for tuning in to KSJE, 90.9 FM over the air, of course, in San Juan County, 103.3 FM over the air in Durango, Colorado, and, of course, streaming everywhere from our website, ksje.com. Welcome also to our viewers who are watching this visual radio program, streaming live to the KSJE YouTube channel and Facebook page. We're glad that you are with us, everyone. Coming up in the next few moments, my guest here in the studio this morning, Ginger Palmer, is here from the San Juan Medical Foundation. We'll be talking about the wonderful Cancer Walkathon, which is coming up a little bit different this year, but it is still happening. We'll tell you about that and some other things that the Medical Foundation is involved with. That's coming up in the next few moments right here on KSJE, so stay tuned for that. Later on this hour, I'll be talking with Dr. Mike Hadabaugh, live from the Encouragement Lab. He always has some great words of advice for us. He'll be sharing them again today at 8:50 a.m. on KSJE. Next hour, Mick Hess is going to take us roving with the arts. It is our weekday classical music program. And of course, Mick today is playing selections from Gustav Mahler, his Fifth Symphony, played by the Berlin Philharmonic. You'll hear that this morning at 9:06 on KSJE. Don't forget, you can also connect with us on Twitter and Instagram in addition to Facebook and YouTube. And let's check out the weather forecast. It's going to be mostly sunny today with a high of 92 degrees, some increasing clouds perhaps this afternoon with a chance of a shower or a thunderstorm. Tonight's low down to 61. Mostly sunny, a bit warmer tomorrow with a high of 94. Sunny and 91 on Friday. Sunny skies for the weekend with highs of 93 degrees and overnight lows near 60. Well, let me turn to my guest who is here with me this morning. Ginger Palmer is here from the San Juan Medical Foundation. Good morning.
Good morning, Scott.
Good to see you.
Good to see you. Thanks for having me.
You bet. Thanks for coming in. You already have a fan on Facebook who's saying hello to you. So there you go. See?
Don't know who it is, but
we don't know.
Hi.
But that's okay. Hello back. So there you are. But it's great to have you here to talk a little bit about the things that the Medical Foundation is doing. And I mentioned the Cancer Walkathon, which is your, must be either the biggest event or one of your biggest events, right?
It's our premier event, the biggest fundraiser we have to support the Connolly Hospitality House and the San Juan Medical Foundation.
Right. And so the question I know everyone's asking is, how do you do that in a pandemic?
Well,
you've been thinking about this, you and your team, right?
We have. We've been working on it for several months and, trying to figure out what's the safest way to do it for our community and follow the governor's health mandates and stuff. So we've decided to do it virtually this year.
Okay.
So we're going to just ask our walkers to go ahead and register online. And, they can go on to sanjuanmedicalfoundation.com and register as a walker, or you can go on and sponsor a walker. If you know someone that's walking and you're not going to be able to walk, then you might want to sponsor someone who you know is walking.
Okay.
So you can go on to, like I said, sanjuanmedicalfoundation.com, and that's a good
there it is.
Right there.
Right there, right? We're showing it on the screen. This is the 40th one.
The 40th
How about
annual
that?
Cancer Walkathon.
That's amazing.
I don't know if there's any other walks in town that have been, in action that long.
I don't think so.
I think we're the longest lasting walkathon, but it's unfortunate, that it had to be our 40th annual walkathon.
To do it virtually now.
Do it virtually, but we're going to make the most of it. We're still excited about it, and I know our community will gather around us and get, involved and help us.
Sure.
Raise the money that we typically raise.
Exactly, because the need is still there, right? You mentioned what this goes for, right? The money that is raised helps support the Medical Foundation in so many ways.
Absolutely. The Connolly Hospitality House is there, for cancer patients throughout the year whenever they're going through cancer treatment, and they're traveling from 40 miles away or more.
Right.
They can stay at the Connolly House at no charge. They've got a place to stay. They've got laundry facilities. They've got a kitchen, with that 3 or 4 families can be in there cooking at once. And,
Right.
We've got a little fitness center there. So they've got all the comforts of home, and they can, just make themselves comfortable and kind of take that stress, that financial burden of having to stay at a hotel, while they're going through cancer treatment.
Right. And I know that there are a lot of folks who have said communities of our size, one, to be able to have a cancer center is another one feather in our cap, and then two, to
Absolutely.
be able to have a place like the Connolly House for out-of-town patients to stay is even above and beyond, because a lot of communities our size don't even offer
That's
things
right.
like that. Isn't that true?
Oh, that's absolutely true. And we are so blessed in our community to have both the hospital and, the Connolly Hospitality House and the Cancer Treatment Center, like you said.
Right.
Because, like you said, communities our size, that just doesn't happen frequently. And the ones that do have them, there's a sizable number of communities that are losing their hospitals, because they're just not able to stay open anymore.
Very true. And it's one of those things, I think, as Farmington serves as kind of the hub of the region, that is kind of why we kind of take the lead in some of these things, of providing these services to our out-of-town visitors, patients, families, whomever is coming into town for
Right.
whatever reason.
Exactly.
So we can register online beginning now, right? It's open?
That's right. It's open. The registration is open now. The screen you showed earlier, all they have to do is go there, click on that Register Today button, and they can register to walk. And then the button right below that, it's sponsor a walker.
Right.
And then go in and sponsor a walker if they'd like.
There you go. But it's going to be a virtual event, so we can go out and can we walk virtually, or do we still have to put some steps down?
You can,
What's the rule?
Well, you can do either.
Okay,
But
okay.
we're encouraging everyone to go ahead and walk 5 miles, because that's what
Yeah.
our normal trek is.
Okay, sure.
We want, we still encourage the exercise and, get out there and maybe even form a team. It's a good team building thing at work. You could form a team,
Right.
come up with a clever name, something like Red Hot Chili Steppers or...
Well, that sounds like you've made that team before. I don't know.
Days,
Yes.
so what was the other
I
one?
like
Cirque
that
Day, sore legs.
Very good.
Maybe
Okay.
got steps, stuff. You get the idea.
I get it. People are very creative.
They are very creative for their
okay.
team names, and we love it. That just makes it that much more fun.
True. Very true.
But you can walk independently,
Right.
as an individual, and you can walk any day between now and September 19th.
Okay.
September 19th is the day that we would normally have the walk.
Right.
So we would, if you want to walk on that day, feel free to. But if you just want to go take a hike in the mountains or, walk around the track for 5 miles, whatever it takes. just
Sure.
Get those steps in. It's good for your health and good for your mind,
Right.
with all we've got going on in our lives right now.
No kidding. Getting out and fresh air is a good thing.
Exactly.
And I would say too, maybe if maybe folks most years can't do the 5-mile walk with everybody, maybe they could do maybe a mile a day between now and
Exactly.
September 19th
That's it.
and contribute and
That's
to participate this year.
absolutely another option. Even a half a mile a day.
Yeah.
You can knock that out in no time at all.
That's true. That's true. My dog will be happy to hear that we can do some walking here in the next few weeks. So that's good.
Good
Very
deal,
good.
yeah.
And the other big question I have to ask is then, are there still T-shirts?
There are T-shirts.
This year?
So
Okay.
if you anybody that raises $50 or more, we ask you to go out and ask your family, your friends, your coworkers, your strangers if you want to.
Sure.
Ask them to sponsor your walk. And then if you raise $50 or more, you get a free T-shirt. And it's a commemorative T-shirt of the 40th annual
Gotta have one of
Cancer
those.
Walkathon. Everybody should have
Gotta
one of
have a
those,
40th
for
anniversary
sure.
T-shirt for sure.
That's right. And we've also got another little special part of it that since it's our 40th anniversary, our 40th annual walk, if anybody that raises $240 or more gets their name entered into a drawing for a special prize.
Oh, okay.
40th annual walkathon special prize. So
Very cool.
we'll
Okay.
be doing some drawings after the walkathon's over to pick the winners for that.
Okay. So we have between now and September 19th, you
That's
said.
correct.
To get our act together.
Yes.
Right? Literally. And get signed up and
signed
we
up,
get the
find your
T-shirt.
sponsors,
Find
get-
our sponsors.
right.
And start walking.
Exactly.
There you go. Well,
The logo that's on the screen there is
Yep.
the logo that will be on the front of the shirt. And I
nice.
think it's going to be make a really nice looking T-shirt.
Definitely.
And,
Collector's
we're-
item.
Yeah.
is what I would say.
That's what I would say.
I think there's a lot of, I bet there's someone listening to us that maybe has 40 T-shirts.
Oh, I know there are.
Yeah.
I know of one lady in particular that has 39.
Okay.
Hopefully she'll have 40 this year.
I bet she will. That's true. So there you go.
So, yeah.
That's terrific.
And
Well,
of
that,
course, we're still looking for corporate sponsors. You know,
Okay.
we have our corporate sponsors that we, reach out to each year, and, we're trying to get those corporate sponsorships in so that we can continue our mission of enhancing the health and well-being of people in the Four Corners community. So
exactly. Well, and so if someone's listening and they want to be a sponsor, they can just call you later today. Is that the best way to do it?
Absolutely. They can call me at 505-609-6805.
Okay. And there's all different levels, I would assume, of sponsorships
Yes,
that folks
there
can sign
are.
up for?
Absolutely. We've got $5,000 level, a $1,000 level. We've had $1,500 sponsorships, so $500. There's different levels. We'll
Gotcha.
accept anything.
And some of those levels would get us on the T-shirt?
On the T-shirt,
Right.
absolutely.
So-
The 5,000 and above, the 1,000 and the 500 get on the back of the T-shirt.
Okay. So
So
there's
some free advertisement there.
there. That's true.
Yeah.
On these special 40th
40th
anniversary T-shirts.
T-shirts, that's right.
Exactly. Very good. And so again, this is your biggest fundraiser.
Absolutely.
And so again, then the money we mentioned goes to support the activities of the Medical Foundation, which includes the Connolly Hospitality House.
Right.
And but there are some other things too that the foundation does for the community. A couple of health funds
Oh,
I know
that's right.
that folks have been helped by in families. There's the Kathy Lincoln Fund for
Right.
women
Uh-huh.
and the Riley Fund for men.
That's correct.
And you've got an event for the Riley Fund, I know, right?
Yes, we do. We have a razor raffle going on right now. We did that last year, and we decided to go ahead and do it again this year. You just go online to at our website again, SanJuanMedicalFoundation.com, or you can go to razorraffle.org, and you can purchase tickets online until September 4th.
And the idea is to win this thing that's on the screen, right?
That's the machine
Look
right
at that.
there.
Holy smokes. We were
I
just
know.
talking about that, right?
I
That-
got to drive it out to that site, and it was pretty fun.
I would think so, right?
I wish I was eligible to win it, but I'm
Right?
not.
You're not. That's true. But talk about your social distancing, right? This could get you pretty far away from people.
Oh, yeah.
If you wanted to.
You've got a good point there. You can get as far away from people as you want.
That's right. And get back.
And
That's
get
the other
back.
important part,
There
too.
you go.
But that's great. And I think last year when you did this, you had a lot of interest
Oh,
from
we sure did.
winning a razor like this.
You bet we did. We saw. I think we raised about $80,000 last year on the razor raffle,
about
and all
that?
that money goes to benefit the Riley Men's Health Fund,
Mm-hmm.
which is a fund that supports any man in San Juan County who is uninsured or underinsured. And if they're 18 years of age or older and have any medical needs that they need financial assistance with, then we can help them up to $500 a year, towards those medical bills or expenses.
Right. So that's a great resource, I think, for men in the community.
Oh,
and
absolutely.
that may, again, have insurance,
And,
but
you
it
know,
doesn't cover everything.
Right. And, right now with so many people out of work, it's been a much bigger demand this year for it than there has been in, years past. So,
Sure.
year to date so far, we've helped 97 men in San Juan County.
Okay.
So
That's-
that makes it really is helping
Yeah, that's a big deal.
those that are in need.
And a big
right.
difference for sure. And the opposite of that is the Kathy Lincoln Fund, which again does the same thing pretty much for women. Is that true?
That's correct. We have the Kathy Lincoln Memorial Cancer Fund. She was a nurse here in San Juan County at San Juan Regional, and very well thought of and loved by the community and her patients and coworkers. And her family started this fund in her name, and it's helped 1,000 women or more over the years since it was started. So.
Right. Another great
She-
thing that we can offer locally.
Right, exactly. And it's, again, for women in San Juan County who are 18 years of age or older, and they are uninsured or underinsured. And but this one is specific for cancer, any type of women's cancer. So, if they have if they're diagnosed with cancer, we can help them with medical bills up to $500 a
Okay.
year. So.
Good to know. And the Riley Fund is pretty much wide open.
Yeah, theirs isn't
men.
restricted. It's any type of medical need.
Gotcha. Very,
Yeah.
very good. Ginger Palmer is my guest this morning. She is the executive director of the San Juan Medical Foundation. We are talking about a number of things on the program this morning, including, of course, the 40th Annual Cancer Walkathon, which is scheduled and happening now. You can register and walk virtually for the San Juan Medical Foundation. And we were talking about the Connolly Hospitality House earlier, and
Right.
I did want to mention, because maybe folks are listening, they may be a bit confused about that the Hospitality House is open, but it's actually serving a different purpose during COVID times.
That's right.
Because of being safe and having to just kind of change the way we do things this year.
Right.
A little bit.
We have closed it to the cancer patients at this point because of their immune deficiencies, while going through cancer treatment. So, we didn't want to have anybody being exposed to the COVID virus, while they were staying at the Connolly Hospitality House. Because
it's
not
still a
only do
group
we have the
thing.
not only do we have the patients staying there, they each have a caregiver who stays with them too. So, with them sharing different, like the kitchen and the laundry facilities and all that, we were just concerned about their health and well-being, and so we wanted to make sure that there was no chance of them being exposed to COVID while they were on our property. So
Right. So that's closed to those individuals, but it's open to others.
Right.
Which is interesting, I think, and a great use of that facility.
Right. We have traveling nurses and EMTs that are staying at the Connolly Hospitality House, and we also have a small RV park where they're able to park their RVs and stay there, and they have access to the laundry facilities and it's
The
just
kitchen and all the things you
kitchen
mentioned, right?
Exactly.
So that's
it's
working
been-
out, I think, pretty well, right, for these
abs-
traveling nurses that are
they
here in town?
appreciate it so much. They just can't. They express their appreciation every day. They just feel blessed to have this place to stay while they're here helping out with everything that's going on at the hospital and in San Juan County these days.
Right, and I imagine a lot of folks don't realize that there are these nurses, these professionals, that is their job, as they travel around to communities that need their maybe expertise or their skill set,
Right.
and maybe they sign a contract for, 6 months to a year,
Right, uh-huh.
And that's what they do,
Exactly.
and they travel all over the place.
I know.
Yeah,
Get to see the world and make a living doing it.
that's true, and it's a pretty good living, if
Yeah.
I'm not mistaken.
And helping people out no matter where they're at. So
That's true.
Yeah.
But this is giving them a place to stay while they're here, as you've mentioned,
Right.
and so it's still being able to be used as some type of hospitality facility.
Exactly. Yeah,
And
and
so-
for the medical, community. So
Right.
So we found a way to put it to good use, even though we weren't able to have our patients there right now. And we look forward to the day where, that we can bring our patients back, because that's the purpose of this facility. That's what Jerry and Bonnie Connolly donated money to get this house built, before he passed away. And so we just wanted, we want to live up to his lifelong dream,
That's
to
right.
have
That mission and
a
that
hospitality house.
exactly. And I'm sure as soon as you can do it safely, and you're like everybody else following the public health orders and
Right.
the COVID safe practices, so
Exactly.
you have to kind of work around those and through with those,
Right, uh-huh.
and to get things done. So, what's next for the San Juan Medical Foundation? I know this year it's kind of hard to predict what's next, right?
It is. All of our events have been canceled. Our Kathy Lincoln Memorial Cancer Fund luncheon that we normally have
Right.
is probably going to be another virtual event, because
Okay.
it's just another, we're
Can't
limited to
gather.
the number of people we can have at a gathering.
Right.
So we're going to be cautious as far as that goes and try to figure out a better way to do that, where people can still be involved, but we won't probably be meeting and having lunch together, unfortunately. So-
Right. But as we were talking before we came on the air this morning, I think a lot of folks are maybe looking forward, and I think this whole 2020 year has maybe made us think about how much we maybe took some of these events for granted, and how
Oh.
it's just would be nice to be able to get together for lunch and
Absolutely.
raise money for a great organization, and just do some of these things that we're not able to do this year. And I think when we get to do them maybe next year, hopefully next year, it'll be all the sweeter and all the better.
Oh, yeah. Everybody's going to be looking forward to those opportunities to get out and get involved again in our community.
Very true. Well, let's remind everyone about the Cancer Walkathon. It is the 40th anniversary
40th
Cancer
anniversary
Walkathon this year.
Walkathon. It is virtual, so we ask that you go out and walk 5 miles, which is the normal route, or normal length of the route.
Right.
You can walk the route that you normally walk at the Cancer Walkathon, or you can go walk on a hike or around a track or through your neighborhood or whatever's convenient for you.
Sure.
We have had one couple send us pictures already of them hiking around Potato Lake. And so they got their 5 miles in, and they've made their contributions, and it's just, they've already got it completed, so we're really proud of them.
Good for them.
And that's one thing that we would love for people to take selfies while they're
out.
walking.
Yeah.
And email them to our website, or to our SanJuanMedicalFoundation.com. Well, I guess that's our website, but they could SJMF at SJRMC.net.
Okay.
Is our email address.
That's the email address. Perfect. Okay.
So they can email those pictures to us and tell us who they're walking for, or if it's in memory of somebody or in honor of someone, or or just tell us why they feel compelled to walk in the
Nice.
Cancer Walkathon each year, and we'll use that on our social media apps and help market our walk.
Yeah, very good. And so we have from now until the 19th of September.
That's right.
So a little over a month for us to walk and
Exactly.
raise our $50
$50
or our $240
or however much
more.
you want.
And
Yes.
but $50 gets us a T-shirt,
That's right.
and the $240 would get us entered into maybe some other prizes.
That's right.
Is-
So we'll be having a drawing after the walk is over to select a winner, or maybe 2 or 3 for the $240 entry, prize.
Right.
So
Very good. And we can go again to the website, SanJuanMedicalFoundation.com.
Yes.
And we see the button right there, register today or sponsor a walker. And so you have two choices. But as we've mentioned, the need is still there to support the Medical Foundation, the Connolly Hospitality
That's right.
House, and the work that it is continuing to do,
Yes.
even in a different purpose maybe.
yeah, and the Medical Foundation. We help San Juan Regional. We're the philanthropic arm of San Juan Regional Medical Center. So we, help them purchase things like we helped them purchase the community van that they bought a couple of years ago. We've helped them build the cancer treatment centers. Whenever they have a need for medical equipment or services, we do our best to help raise the money that they need to, update facilities and,
Right.
whatever they need.
They can come to you and see if you guys can help them out. And I just can't
Right.
imagine all the pressures that the hospital's been under these last few months, and the staff.
Right.
We talk to them all the time.
Right.
But I mean, there's a lot that goes on behind the scenes that I don't think the public's really
Right.
aware of, with COVID and just other hospital stuff that they're dealing with day in, day out.
Yes, and we, just recently started a COVID-19 supply and equipment fund, and so we've been able to raise money so that to help the hospital buy PPE,
Right.
for the healthcare workers, and equipment that they need to treat the patients. So
That's true. I think that was the last time you and I spoke
It is.
on the show,
Yes,
talking about that fund,
exactly.
right? And that's been going very well.
It has. We raised about $70,000, so
How about that?
our community's been very generous, and we appreciate them more than they know.
That's wonderful. Well, and I know when we talked back in April, PPE was pretty scarce, and I
Yes.
think now it's gotten a little better. At least I hope it has.
Yeah, it is, and they figured out ways, to recycle the N95 masks and some of the gowns and stuff. So that's helped too. But there's still a need. There's still need for new equipment every day. So
Right.
we're still there. If anybody wants to contribute to that fund, it's still an active fund.
Good
So,
to know.
Yeah.
And you're right. A lot of that stuff is a one use only, and then you
Right.
got to just toss it away because it's dirty. It can't be used again.
Exactly.
So that's important to know.
sure.
Well, Ginger, thank you for coming in this morning. It's great to see you.
Oh, you're very welcome.
Once again, the phone number, if folks would like to maybe sponsor the Cancer Walkathon or become a sponsor or anything else.
505-609-6805.
Okay. Very good.
All right.
We'll see you virtually walking.
Yes,
Very
absolutely.
good. Thank you, Ginger.
Oh, you're welcome. Thank you.
You bet. Ginger Palmer from the San Juan Medical Foundation, my guest here on KSJE. And I'll be back with more in just a moment, everybody. The time right now is 8:34. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at